Good morning, Paulo. Thanks, Dr. Janice. Thanks, Amisha, for coming. Thanks for being here today. And first of all, I want just to say that this survey there's a lot of studies going on in the UPPs in Rio, and that's a very positive sign. And this survey was the first one and should be conducted in every single community with UPP. And the main goal is for the state government and also for the society as a whole have a picture about what's going on here and use this as a tool to the public policy decision making. This doesn't intend to be the universal truth about UPPs. It's just to provide an additional public policy tool. Having said that, I just want to thank, there's a lot of professionals that were involved in this survey. So, and it's not an easy task to do surveys in 70 communities. So I'd like to thank all of them that were involved. And I'm just here representing this work for many professionals. And as Paulo was saying, we had a lot of data and a lot of material. I just sent to Paulo a 400 slides presentation. He's told me to keep it short. So I just have just to reduce for 100. So we have 4 hours to speak about all the data. So be patient. But first of all, this is the current location of the map of UPPs. Now they're gonna. I did this before they invaded Rocinha, the very famous community in Rio. That's gonna be installed very shortly. But as you can see, this provides kind of a map and have 3 informations. When the UPPs were installed in each community. The first one was in Santa Marta and in 2008, as mentioned. How many people actually live there, how many residents, and how many police officers, UPP police officers in each community. In average, they have about 150 UPP police officers, but really depends on each community has his particular issues, and of course it's related to the number of UPP officers. Just in terms of sample, we interviewed about almost 4,000 people, but we actually collect data for about, and we asked questions about spouses, about children, about relatives, and what in Brazil we call aggregates, that people that live in the same housing unit. So we have data in about 12,300 people. So this is the basic sample, and we have data from every single community. I'm going to start trying to answer the key question. And this is a picture that was taken when the UPP Dona Marta, the first one, completed 1 year of the anniversary. And I think the key question is, does UPP make people feel safer? This is a very direct question. And the results, as you can see, 67% of the people that were interviewed think that security in their communities are better compared to before the UPP. And we have 5% saying that the security is worst. But of course, depends on which community. And I was kind of blessed because I have been to every single community, and I have spoken to, and I try to do at least one questionnaire in every single community. And there are differences. So the top 5 communities in terms of people feeling safer are Dona Marta, Cidade de Deus, Chapéu Mangueira, Batã, and Andaraí. And I was kind of trying to ask myself why those numbers are very high on those communities. And first of all, and for example, Cidade de Deus and Dona Marta, the first 2 UPPs, one thing that I felt walking the streets and doing the surveys was that as longer the UPP stays, people feel more like safer, and they kind of adapt themselves to the UPP. So longer UPPs in the community, most likely the people feel safer. In the case of Batã, that's a very interesting case. Most of the UPPs were taken back from the drug dealers, except for Batã. Batã was a community that was taken by the militias. I don't know if someone here watched a movie called Police Squad Part 2 that focused on the militias in Rio. And the militias, they are much tougher in the communities because they have more than one line of business. It's not just drugs. They do a lot of illegal activities. And they are much tougher because usually the drug dealers are from the communities. And the militias that are corrupt officers are from outside the community. So they are much tougher on the community. And Bataan itself, the people feel really relief from the militias. Another question that, because as you saw on the movie, key question, are there enough police officers, or do you feel that there are enough police officers in the UPPs? And you see there is a lot of positive answers in terms of entirely appropriate and appropriate number of police officers. It's interesting that communities that have suffered, even after the UPP installation, some kind of struggle with drug dealers try to come back, they tend to answer that the number of police officers were not appropriate. And for example, the case of São Carlos, that they kind of had an issue that one of the drug dealers tried to come back. But this is kind of a good sign. And one of the key issues for the security is that people felt very unsafe with police officers for many reasons, because of their corruption level, because of the attitude when they enter into the communities. And the UPP police officers are trained to deal with community issues. So one of the questions that we came to people was, are the officers prepared? Do you consider that UPP police officers are well prepared, fairly prepared, unprepared? And there is a fairly positive answer in terms of well prepared and fairly prepared. Again, depends on the community, of course, and of course the UPP police officers and the training was changing over time with feedback and lessons learned from the first UPPs. For example, one of the things that they learned is that in the beginning, most of the UPP officers were male men, and now they are kind of hiring more lady officers to kind of balance it. And so this is a change given the feedback of the community. For example, in the Dona Marta and Cidade de Deus, they felt that especially the teenagers, the male teenagers in the community were feeling very jealous with the UPP police officers because they were kind of dating all the girls there. So they start to change that. So that's also feedback. And another number that I want you to have this number, we asked the question, do you think that the UPP police officers are corrupt? And 73% said no, they don't feel they are corrupt, and 7% said yes, they are corrupt. So this is something that the Secretariat of Security is monitoring very closely. And like I said, one of the goals of the survey was to give some diagnostics, some picture about what's going on for the government and for the society as a whole. So when you talk about employment and education, the first thing that I can share is that there's many things to be done. And I think the state government, they are aware of that. For example, one of the things that we felt, we just kind of try to measure what's the level of poverty in those communities. Not the poverty that we speak here in Washington, like people living with less than $2 and $1 per day. Because if you have been in Rio or São Paulo, that's kind of impossible. But we kind of number of households that live with less than the minimum wage, and the minimum wage in Brazil is about $300, divided by the total households of those communities. And still there is significant numbers of people living with less than the minimum wage. And of course, that kind of varies from communities. But anyway, this is a sign that there's a lot to be done. In terms of employment, and when I define employment here, is this occupied people divided by active economic population of those communities, just to have an idea in Brazil, and the source is the IBGE. Brazil have a 54% of employment rate, and Rio about 52%, and the total of those communities is 48.5%. Of course, again, depends on the community. We see communities, especially if you go to Rio, communities close to the south area of Rio and close to the upper middle class areas, neighborhoods in Rio, for example, Pavão, Pavãozinho, Cantagalo. That's very close to Ipanema, Copacabana, and Leblon. they have a kind of level of employment rate higher compared to those communities, and because those neighborhoods, like, they are benefiting from the installation of UPPs, not only the community itself but the neighborhood. There was a study from a local professor that said that the rent in those communities close to the UPPs are kind of 20-25% higher compared to the period before the UPPs. So that's why people from the communities are benefiting from the externalities of the neighbors close to the communities. In terms of income, you see the Brazilian and Rio income. Again, Rio has a higher income compared to Brazil levels, but still the UPPs are behind the Brazil levels and are behind the state of Rio levels. So there's a lot to be done on those sectors. And what concerns me a lot, it's because there's a lot of family-head unemployment rate. So especially the older people. And you see this is an employment rate of family head divided by unemployment total. Still, we have very concerned numbers. And for example, in Cidade de Deus, 33%. And that's another fact. Cidade de Deus is located in the west side of Rio. And there is no much economic activity behind and close to Cidade de Deus. And of course, the people had to work and to take like 1 hour, 2 hours to go to work in those kind of communities. And so this is something to be aware. Still, there's a very high level of illiteracy. It's lower compared to Brazilian levels, but the Brazilian levels are with 9.7. But given that the north and the northeast of Brazil, the situation is still very, very bad. And but still, we have communities. There's a lot of people that don't know how to read, and of course, when I was interviewing those people, you feel that even if they say that they can read, you know that they have a lot of issues to read. And when I was showing, for example, in the interview, some sign to them to choose an option, and suddenly I realized that they were not getting what was in the sign, and it was very simple. So it strikes me, even in the favelas close to the important areas of Rio, for example, again, Pavão, Pavãozinho, Cantagalo, Prazeres, or even Santa Marta, the level of people that don't know how to read and write, it's kind of a big concern. And like I said, that was something that strikes me, and it's like a puzzle. We have these favelas in the south region of Rio that have more people that will say that they don't know how to read and write, but even that the employment rate was lower. And that was basically, I'm trying to seek to the exact explanation, but basically because they're much more closer to economic opportunities. And for example, for someone living in Cidade de Deus or City of God to have a job, this job has to pay the opportunity cost of people like going back and forth. So being close to economic areas, Rio, like it's very important to the employment rate. And in terms of, there's a lot to be done. And the key question I ask it, do you receive or participate in any public social program? And they have a lot of public and social programs in Rio and Brazil. And this is the people that said, no, I don't participate, I don't receive anything from the public sector, is basically very high. And this is interesting because this is one of the goals of the research, to see in each community, for each kind of secretary, health, education, and security, what can be done. And this is a very interesting sign. The only program that they are kind of involved is the Bolsa Família. It's the income transfer program from the federal government. And that's a very interesting thing. This is Rio de Janeiro city, from the metropolitan areas in Brazil, is the city that in the southeast that receives more from the federal government, given the relationship that the state government has with the federal government. So Bolsa Família is a very strong program in Rio. And some communities are very privileged. For example, Fogueteiro or Providência, that's a lot of people getting Bolsa Família there. And but when you ask, and of course there's an issue of employment, there is the issue of income, there is the issue of education. But when you ask people that, are you interested in taking any kind of professional capacity training or professional developing training or anything, and even people don't, I felt when I was doing the interview that sometimes people don't fully realize what as a professional capacity trainee is. So you kind of have to go through, but even most of the people are interested and taken. Of course, they have no clue how to enroll, how to engage, but then this is something that will drive the government to offer capacity training in those communities. The first thing that I don't have this in this slide, but the first thing that comes to mind to people is to learn how to operate a computer. But there are also there's a lot of demand right now in Brazil for construction workers, so there are people that are looking forward to learn how to be a construction worker as well. So that's what they claim. And I don't know if you saw in the video, there is a bank branch store. And this is something that's a real big opportunity for banks, for people, for access to credit, etc. So right now, when you ask about access to financial services, I was asking, have you tried to purchase something through any kind of source of credit in the last 6 months? And most of the people said no. And when I explained that credit was not only credit from banks, but credit from retail stores, etc., etc. And the people that said yes, there's a lot of people with credit cards, even living in an illegal, completely informal situation. There's a lot of people with store collections from Brazil. It's very common to go to a store and pay in installments. And it's interesting that if I had done this survey like 10 years ago, the level of predated checks in Brazil was much higher. Today it's kind of disappearing. And predated checks have something very, I don't know Latin American or not, but you need to trust a lot that you're going to sign a check today and just ask the people to just to keep the check for 30 days or 60 days. But this is kind of decreasing those communities. Just to have an idea, in Brazil right now, there's 53% of the population has credit cards. So even if you consider that we're talking about 20% of the people in this community with credit cards, we have a lot of potential to people to access credit. And again, each community has their own situation. And what I felt was in the communities of the west side that are far from the center, the need of banking access is much higher because people don't have the basic transactions from any bank. Like they need to walk for 1 hour or take a bus for 30 minutes. So still, there's a lot of opportunity in those communities in the west side. And that is reflected in the answers that they gave to the question. And I heard, and just to finish that one, I heard that the government is talking to many retail banks to install branches in those communities. And the key challenge for those banks is because of all the informality of the location and the properties, it's very hard to find a location that a branch can be there officially. So that's the challenge right now. But they are speaking to many retail banks, including the public and the private sector retail banks. And you saw you saw Santander branch in the video. That was a kind of a pilot of about the living conditions and health. And just want to make a disclaimer. About the healthy conditions. I just ask people about their health conditions. It's very hard to compare it to official data that are collected in hospitals with diagnostics, etc., etc. So first question, and this is anyone that have been to any of those communities are terrified by the living conditions. And I was asking, what's the size of your property? And most of the people don't know, because square meters is a concept that is tough for them. And I was kind of feeling that we need to explain, do you have just 1 bedroom, 2 bedrooms? How is the space? But anyway, most of the people don't know, but there's a lot of people that said that they live in a place with less than 20 square meters. And it's a very sad situation because you go to those places, and I have been to a lot of small places there and saw people living with 5, 6 people in a 20 square meter residence, and this is critical. And there's a very and of course in some of the communities there have some issues about when it rains, and there's a very dangerous areas that people could not stay because they built the house in in the middle of the mountain, etc., etc. But once there's something that people are concerned now because of the UPPs, the rents in the communities they have risen. So it's more expensive to live in a UPP community right now, and of course because people are coming with legalize many things, so they're gonna have to pay electric bills and etc. There is and also build a new home right now, new house there is gonna be tougher with the state there. There is a lot of concern about pressure of people to building new houses in bad conditions or building a house like another bedroom above, etc., etc. So there is this housing issue is going to be a very critical factor. There's a lot of discussions about land title and make it legal those communities, but there's the legal issues, there is the urban issues, so that's going to be a very big challenge for the government. And because of they live in those conditions, and kind of questions about health, I asked basically if they had one of those diseases, and those are dengue in the last 12 months, and 70% said yes from the ones that they said they had these issues, diarrhea, and respiratory disease. And it's very, very easy to, I'm not a physician, I'm not a specialist in sanitation, but when you go there, it's very easy to understand what people have dengue. It's very easy to understand why people have respiratory issues because all the houses are in a terrible condition and people live together in a small place. The water and sanitation in most of those communities, I would say that from the 17 that have been, like 3 or 4 are in average water and sanitation conditions, though the rest is very below average. And you see the children still playing close to those. So there's a huge challenge in this housing and water sanitation. And it's very sad when you go there, especially when you see children close to that and see children sick. So like I said, I'm not a physician, I'm just telling you what I saw. And so there is a task force from the health secretary to kind of put unities of health very close to those communities. And this is in some communities the situation are very bad, and this is I would say if they had a priority right now, this be the water, sanitation, and the health conditions. So just one of the key questions when I was asking, what do UPP residents consider the main problem? So there's a lot of problems. I just try to keep it simple. First of all, they complain a lot of lack of public lighting. So if you go to any kind of those communities, in the beginning of the community, there's a lot of lighting, but when you go deep and you advance on the communities, it's a very tough spot. So I imagine when they had the drug dealers there, I can't imagine why the drug dealers was like occupying those areas because there's no public lighting at all. Just in the entrance of those communities. There's of course the lack of social programs, and you saw the question: are you involved or do participate in any social program? And still the answer was very low. There's lack of physicians and medicines in the hospitals. Some communities are lucky to be close to public hospitals. The other communities, especially again in the west, and even some communities in the center, in the downtown area, they have to drive, or they have to take a bus. It's very complicated to get to a public location, and that's what they complain about nearby hospitals. And you see that in some communities, and they complain of lack of water treatment and sanitation. And what is said about this lack of water and treatment and sanitation, that most people have no idea what's a good treatment of water and sanitation. So the reference is very low. So they complain, but and anything that can be done can make a huge difference there. And so there's another thing that is not included as a main issue, because water, sanitation, health are the key concerns. There is a lot of complaint about lack of programs related to the youth, to sports and culture and etc. There's a lot of initiatives right now, to be honest, and I saw, but still people are testing, and you imagine those communities were like completely dominated by the drug dealers in very recent history. So there's a lot of things to be done. And just to keep it short and move on, this survey and the completely survey, and I'll be happy to share the 400 slides that I have that Paulo didn't let me go through. But this was supposed to be a work for the Secretary of Labor, but it ended up to cover a lot of material. So they had the governor had the completely survey, and he kind of shared with all the secretaries and asked them to try to think about the action plan, include what they are trying to do also for each community. So like I said in the beginning, this is not a universal tool about UPP communities. It's just an additional tool for them to try to do something. And one of the things that they saw in the video about evaluating and monitoring, there's a lot to be done, but it's good that we are kind of trying to make decisions based on data. And this sounds obvious, but in Brazil it takes a lot of time and sometimes a political will. And I just want to finish with that. I was watching, there's a Brazilian journalist and also a movie director called Ronaldo Jabor, and he was talking about the UPPs. And he was first of all, he was saying that the UPP is not a miracle. UPP was just the most obvious thing to do, was just go there and occupy the space that was occupied by drug dealers and just include them in the whole society. And he said that UPP was very obvious to be done, but in Brazil the obvious is not that obvious. So that's what he said. Thank you.